does the state owe Burlington anything for what happened here?
There's no way I can say that either the Department of Health or any sector of state government did anything wrong in this entire process, and that, if anything, the city of Burlington's actions and the predicament they found themselves in helped the rest of the state because it generated the need for legislation and an entire testing and regulatory framework that didn't exist before. In real time, we are protecting Vermont students and staff from the toxicity of PCBs.
It's a point of pride for Health Commissioner Dr. Mark Levine that Vermont is proving itself a pioneer in the exploration of PCB contamination in schools. But the question on many minds, did forging a path to the future cost Burlington taxpayers millions of dollars and hundreds, if not thousands of students, a quality education and social emotional stability?
Burlington students sustained more harm than any other town or city in Vermont. That is the argument from families because of the school closure. What do you say to that?
We are a data-driven health department. I need to see the data that actually supports that. This, adding insult to injury, while it wasn't good, I'm not sure it made Burlington students even less able to rally and have the resilience they need compared to other high school students.
Statistics measuring learning loss from the pandemic will never have because there was no statewide assessment. I did obtain enrollment data from the Burlington School District revealing from when the campus closed in fall 2020 to the end of the first full year at downtown BHS in spring 2022. About 100 students transferred to another public, private, or alternative school, dropped out, or moved out of state. This academic year, though, enrollment bounced back to pre-pandemic figures.
There was no formal state recommendation that the school be closed.
But Superintendent Tom Flanagan and the school board say following the health department's guidance felt like an obligation, not an option.
We didn't have a choice.
The decision, Levine and Flanagan say, was made in consultation with knowledgeable EPA officials and PCB experts, who remarked in astonishment they'd never seen numbers like the 7,000 nanograms per meter cubed PCB concentration detected in the tech center's indoor air. Testing results from the other 5 buildings spurred outrage among Burlington families. I analyzed the data, and none of the hundreds of samples exceed the U.S. Environmental Protection Agency's guidance of 600 nanograms per meter cubed for high school-aged students. Then, in November 2021, when lawmakers charged the health department with creating a new set of standards for the statewide PCB school testing program, officials established the so-called school action levels, 6 times more stringent than the EPA's.
Why the large departure from the EPA's recommendations?
The EPA's research that their levels were derived from is from 1994. The research that we are using in determining our levels is almost 30 years more modern.
So if the EPA knows that Vermont is operating on modern research and they are operating on 30-year-old research, why hasn't the EPA caught up with Vermont?
Compare it to sort of a sailboat versus an ocean liner. It's much more easy for us to pivot at a state level than it is for a federal structure like the EPA to do that.
Still, less than a quarter of the BHS BTC sampling results surpassed the state's 100 nanogram per meter cubed school action level.
Why couldn't students reoccupy Burlington High School? It was during the pandemic that this was all happening, so students were learning remote half of the time anyway. That was the plan. So it's almost like by design, they would have had spent limited time in those spaces.
We can't look retrospectively and say, now that we know what every room looked like in those schools, could students have gone to building A and building B, but not any of the other buildings, or what have you? We'll never know that.
Levine explains that's because the campus wasn't tested for PCBs using the protocol we use now, an inventory method that groups like rooms constructed with similar materials together. Though consultants only sample about a third of the total spaces in any given school, results from one room are applied to others in the same group. In short, the sample results from BHS and BTC aren't an accurate reflection of the magnitude of PCB contamination there. But as Vermont communities face legally mandated testing in their own schools now, could we have avoided this rush to remediate had the state conducted a more comprehensive pilot study back in 2013?
How could we possibly know, based on the results of just 4 schools, that we didn't need to test the rest of the schools in Vermont?
Keep in mind, 2013 was a very different time. Most states had not done any pilots of any sort. And not knowing the ramifications at that point in time, we felt comfortable saying we've at least done due diligence.
Is that good science?
It was good for the time. This integration of the non-cancer effects of PCBs has, I think, been the most important finding of this last decade.
Does Vermont have a reputation of being ahead of the game when it comes to public health
We
standards?
do, and that's a double-edged sword, because we tend to do the right thing first, and then people look and go, wow.
A rap sheet shows, Levine insists, Vermont was right to implement strict regulations for lead and PFAS first, and we're in the vanguard now with PCBs. Soon, he's certain other state and federal officials will follow suit.
Why should families trust the Vermont Health Department and its recommendations over the EPA?
Because the EPA is actually at our side. So even though it may be delayed from our pilot study in 2013, we've picked up the ball very briskly and are doing really landmark work here.